Hi there, my name is John Pilcher. I'm a bariatric surgeon in San Antonio doing gastric bypass and gastric sleeve. And sometimes my patients will come back to me after their surgery and they'll say, I know when to stop eating because I have hiccups, or I sneeze, or my nose is running. And I've got to tell them, and I want to tell you, that using those signals is too late. You have overfilled your stomach. You filled it up to the tippy top so that the tissues at the top of your stomach are irritated, and that's why you have the sneeze, or the hiccups, or the runny nose. You might have felt like that was a reasonable serving, but you might have an eyes too big for your stomach thing. You think, okay, this is what I need right now, but your new little stomach pouch is sitting there like, okay, that's not the best way to go. And so there are different theories about exactly what's going on with the bariatric sneeze or the bariatric hiccup. Most of the theories have to do with stimulation of the vagus nerve, which is at the top of the stomach, or maybe the phrenic nerve, which is part of the diaphragm. And I'm not sure, but I do know for sure that the universal thing is that it means that the food is putting pressure on the very top end of these structures. And that's not necessary for satisfaction and for taking care of your hunger. The runny nose thing is slightly different, and that's when the structures here have begun to perceive the food as an irritant, and the entire upper intestinal tract, including the nose and the sinuses, is secreting fluid mucus to try to flush through that irritant. It perceives it as an irritant because it's overfull. And so the better way to go is what I call conscious eating, gentle eating, and it starts with the sensation of hunger, and you don't even choose to eat until you feel hungry, and then if you do feel hungry, you eat enough just to take care of the hunger, and not until you're absolutely full. When you're absolutely full, like I said, that's getting into the overstretching of your stomach pouch. And as I recently posted in a video, we're not worried in particular about damaging your stomach pouch, but you're eating more calories than you need, and you're probably training your little stomach to handle more food or fluid than you need. Okay, so gentle eating, come up short of the hiccup or the sneeze. Now, one more little scenario I want to touch on before I'm done with this video. If this is happening to you in spite of your best efforts and you're trying to be gentle and conscious and you're eating small amounts, but you're still having ongoing hiccup or sneeze or runny nose or retching or heaving, get in contact with your surgical team, because that's not expected in the long run. Rare scenario what I just touched on, but just want you to know that that deserves an additional conversation. Okay, so bottom line, eat just according to hunger, eat gentle, eat conscious, and that's the way you're going to have the best long-term success. Best wishes.